Hello, discerning humans, and welcome back to the show that keeps refusing to tell you what you want to hear and keeps being right about it anyway. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who is about to say something about hair, skin, and nail supplements that the wellness industry has been carefully avoiding for years. Dr. Lazuk is not with us today because she is currently at a nutritional dermatology research conference in Geneva, Switzerland, having accepted an invitation to present on what she described as the gap between supplement mechanism and consumer expectation in structural tissues. She delivered her presentation. It generated what attendees are describing as the most uncomfortable silence, followed by the most productive conversation this conference has ever produced. She has since been asked to extend her stay, review 3 unpublished studies on bioavailable silicone, and apparently moderate a panel that was not originally on her schedule because, in the words of the organizers, nobody else will say what needs to be said. She has agreed. She is, by all accounts, exactly where she belongs. We have sent a later flight. She has acknowledged it. Acknowledgement and departure remain, as always, different things. So, you have the avatar, and today we are having an honest conversation about a supplement called Lustriva, and more broadly about how to actually think about hair, skin, and nail supplements in a way that leads to real outcomes rather than repeated disappointment. Let us start with the moment that creates the market for products like this. You are doing everything right. The routine is solid. The diet is reasonable. The sleep is mostly adequate. And yet, hair feels thinner than it used to. Skin feels less resilient. Nails break more easily. And there is a quiet, frustrating gap between the effort being invested and the output being produced. That gap is real, and it is also where confusion begins. Because the instinct when facing that gap is to look for the missing ingredient, the one thing that will flip a switch and restore what time and stress and biology have gradually altered. Here is what Dr. Lazuk needs you to understand before evaluating any supplement in this category. Hair, skin, and nails are not active organs in the way most people imagine. They are output tissues. What you see is the result of processes happening much deeper: nutrient delivery, cellular turnover, protein synthesis, circulation, inflammation control, and timing. When those underlying systems are efficient, output looks strong. When they are compromised, output looks fragile. Supplements do not create new systems, they support existing ones. That distinction matters more than any marketing ever admits. Lustriva is built around bioavailable silicon, paired with biotin and supporting nutrients including zinc. Silicon is not a growth stimulant. It does not tell hair follicles to activate. It does not alter hormonal signaling. What it does is considerably quieter and considerably more specific. Silicon plays a role in connective tissue integrity, contributing to the structure that holds collagen fibers together, influencing tensile strength, and supporting the matrix in which hair, skin, and nails are formed. In simple terms, it supports the quality of what your body is already producing, not the quantity. This is where expectations either align or collapse. If hair thinning is caused by hormonal shifts, autoimmune activity, follicular miniaturization, or scarring alopecia, silicon will not reverse that. It cannot override signaling pathways it does not control. If skin laxity is structural and deep, no supplement will tighten it. If nail brittleness reflects systemic disease or significant nutritional deficiency, support alone will not correct it. But when hair and skin quality decline because the body is struggling to maintain structural integrity due to aging, stress, inflammation, nutritional inefficiency, or recovery from illness or procedures, support can genuinely matter. That is the window Lustriva operates in, and it is a real window with real people inside it who genuinely benefit. Now, Here is the timing confusion that drives most of the polarized reviews and that almost nobody explains clearly. Hair growth cycles are slow. Skin remodeling is gradual. Nails grow at a predictable but frustrating pace. When someone starts a supplement and notices improvement in a few weeks, what they are usually seeing is reduced breakage, improved hydration, or stronger keratin formation, not new growth, not follicular activation. Stronger hair shafts break less, so shedding appears reduced. Nails split less, so growth seems faster. Skin feels more resilient, so texture appears smoother. These are real changes, but they are being interpreted as stimulation when they are actually support. And that misunderstanding fuels both glowing 5-star reviews and furious dismissals simultaneously about the exact same product producing the exact same outcome. People who needed structural support feel validated. People who needed medical investigation feel misled. The product sits in the middle, being praised or blamed for outcomes it never had the biological power to determine. There is also something worth naming about the role of the broader internal environment. Hair and nails are not priorities when the body is under strain. Chronic stress, elevated cortisol, systemic inflammation, sleep disruption, and hormonal fluctuation all redirect resources away from what the body classifies as non-essential tissues. In that state, supplementation becomes less effective, not because the ingredient is wrong, but because the environment is hostile to using it. This is why people sometimes notice better results when they change nothing except their stress levels or sleep consistency. The supplement did not suddenly start working. The body finally had the conditions to allow it to work. And this is why Dr. Lazuk cautions clearly. Supplements cannot compensate for ongoing inflammation, unmanaged hormonal imbalance, iron deficiency, thyroid dysfunction, or poor circulation. They can enhance a stable system. They cannot stabilize a broken one. Here is the guidance that is almost never offered but is genuinely necessary. If hair thinning is sudden, patchy, accompanied by scalp symptoms like burning or itching, or accompanied by other physical changes, supplementation is not the first step. Investigation is. The danger is not that Lustriva exists. The danger is that supplements are often used to postpone asking better questions. A reasonable evaluation window for structural supplements is months, not weeks. But that window is not infinite. If hair quality, skin resilience, and nail strength have not shifted meaningfully after sustained, consistent use, and foundational factors like protein intake, sleep, and stress have been genuinely addressed, continuing out of habit rarely changes the outcome. Stopping is not failure, it is information. Here is what responsible literacy around supplements like Lustriva actually produces. Not skepticism, not faith, but alignment. Understanding that hair, skin, and nails are reflections of internal conditions, not levers to be pulled independently of everything else happening in the system. When someone understands that, they stop chasing solutions and start supporting systems. Progress becomes quieter, steadier, more sustainable. Lustriva does not need belief to work. It needs the right conditions. And creating those conditions, reducing inflammatory load, supporting sleep, addressing foundational deficiencies, giving it adequate time, is the work that determines whether support has anything meaningful to amplify. That is not exciting language. It does not promise transformation, but it is honest. And honesty, in a category built almost entirely on hope, is exactly what people are actually looking for when the hype stops working. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, a recommendation to use or avoid any specific supplement, or a clinical assessment of your individual hair, skin, or nail concerns. Sudden or significant changes in hair, skin, or nails deserve professional evaluation before any supplementation decision is made. Please consult a licensed dermatologist or qualified physician for personalized guidance specific to your situation. Biotin supplementation may also interfere with certain lab tests. Please inform your healthcare provider if you are taking it. Dr. Lazuk will be available for consultations as soon as Geneva concludes and someone successfully boards her on a return flight to Alpharetta. May your skin always glow as brightly as your smile.